Hi, good afternoon. I'm Teresa Baker. Today I'm going to show you how to set up and how to monitor a transvenous pacemaker. So you have a patient that comes in, is in third degree heart block, and the doctor tells you that you need to set up for a transvenous pacemaker. So you're going to go in the back supply closet right to this cubby back here on the back wall that says pacing catheter pacemaker. And inside of there you will find the pacemaking generator. This is what it looks like. If you don't have the cord connected, you up here at the top, then you also need to have a cord, and it snaps right in the top, just like this. And the first thing that you need to do is you need to make sure that your generator has a battery. There are two pressers on both sides. You press them at the same time and the battery box pops out. Then you're going to get a 9-volt battery and a new 9-volt battery, I must say. And you're going to insert it in the little drawer. And then to see that it is working before you start, you need to press the on button on the green. You're going to move the plastic bar and push on. If you see lights coming on right over here, then you know that it is working. The next thing you're going to need to know is that there is another supply you have to get, and you're going to go way up here to the top in the arrow box. It has the blue and the orange color, and it says temporary pacing catheter at the top. You can't get any of the other ones. It has to be the orange one, or your pacemaker will not fit in the Cortez. Then you're going to take your pacemaker and your Cortez, and you're going to take it to the patient's room. And inside the room also will be a central line kit that you're going to assist the doctor. So let's go to the patient's room. Now we're in the patient's room. This is where you're going to set up for your pacemaker. This is the central venous catheter kit that the doctor is going to need, because this is considered a very sterile procedure, because you're going to place the catheter directly into the heart, and chances of infection are very high. So you have to make sure it's very sterile. All the supplies that are needed for the sterile procedure are in this kit the doctor will be using. We have our kit here again for the temporary pacemaker. As the doctor is preparing his sterile field to put the pacemaker either in the IJ vein or in the subclavian vein, he's going to be sterilizing that site. And so you will be opening up this pacemaker kit just like this. And everything inside here is sterile. If I can get it out. Is sterile inside of the blue. So when you're giving it to the doctor, you will not be touching any of this that's inside. He'll be opening this catheter, but for education's sake, we're going to be touching things today, so we'll know what's inside. Chlorhexidine, of course, to sterilize the field. And inside here is a sterile barrier. This is the pacemaker itself. This is also another sterile barrier to cover the patient. And these are the things that the doctor is going to use to insert the pacemaker. All right. So if you look at the pacemaker, we're going to open this up so we can see how this pacemaker actually works. All right. So this also, there is a Cortez that the doctor has to insert. As you look at it, it looks like a regular Cortez, a yellow one, but if you look at the color is green. And pacemaker Cortezes are always green, not yellow, not blue, but green. If it's the wrong size Cortez, it will not fit the pacemaker. So the doctor will insert this Cortez in the IJ or the subclavian, and then he will, in the back of the hole here, there's a little trap door, he will insert the pacemaker. At the end of this line here, there's a little metal pacemaker, and he will insert it in here when he gets this Cortez in the correct place. Also in here is a little syringe that the doctor will hand to you, not that one. Oh, this little syringe that the doctor will hand to you. It only measures a certain amount of air. It cannot pull back anything more than what is needed. And so what you will do is you will screw it onto the end here, And at the end of the pacemaker, there will be a balloon. So look at the tip, and as I inject air, the balloon should be opening up. Can you see the balloon there? And then we're going to let the syringe go back, and the air goes out of the balloon. You're going to check that before he inserts it, and then you'll go ahead and lock it. So now, that way you can't overinflate the balloon and make it pop. That's why there's only a small amount of air in there. So after the doctor has this in, you will be prepared to insert the pacemaker. Inside of here also is little adapters that go to the end of your pacemaker box. Right now they're already in place. These adapters come and you'll put them in the positive and the negative spot, because at the end of your pacemaker there will be a positive and a negative connection. P for positive always goes on the positive spot, it pops down, and this is negative, it goes on the negative spot. You make sure these are nice and tight so they don't pull out, especially when they're in the patient's heart and their pacemaker is working. You don't want it to come disconnected. Now you're ready for the doctor to place it in the pacemaker. Your box is connected here, it's connected to the pacemaker, and the light is on. The doctor will tell you when he gets the pacemaker in how fast he wants the heart rate to go. This first dial here is for heart rate. So if the patient's heart rate is 30, the doctor may say, let's put the pacemaker at 60 or 70. So you will, when you get it in, you will pace faster than the patient's heart. So you'll preset the rate that you want the pacemaker to go. And the next dial is the output, which is the MA, milliamps is the output. And that's how much electricity is necessary to go through the pacemaker to cause the heart to contract when it's in the right place. Most of the time we put it pretty high at the beginning and then lower it depending what's needed. So around 10 is an average amount, and it's all for doctor's discretion, but that's an average amount. And then the bottom here is the sensitivity. This says how sensitive this pacemaker generator is to the patient's rate. So you want to have it on the over here at the sensitive side when you start, just so you can sense the patient's own beat, because this pacemaker works by demand. If your patient has its own heartbeat, the pacemaker stops. If it doesn't have its heartbeat within the amount of time that is set on here, then it will give it a spike and will cause the patient's heart to beat. So you want it to be sensitive to the patient's needs, and that is what the sensitivity is about. So the doctor will tell you to set that, and you will set it, and then he will take the pacemaker, and this is inside of the patient's vein, and will inject it, not inflate it, not yet, into the patient. And it'll go about, you'll see on the pacemaker there's lines. There's one black line for 10 centimeters, two black lines for 20, 30, etc. on your catheter. And so once you get down to 20 here on the outside, you should see when you're about 15, it starts coming out the other end. And you want it to go down into the right atrium, so the doctor will push it to about 20 centimeters. When it gets to be 20 centimeters, as you can see, it's going through the bottom of the catheter into the right atrium. At that point, the doctor will tell you to inflate the balloon, and then you're going to be out of the sterile field. You will inflate the balloon, and as you look at the tip of it, as I push the balloon in to inflate it, you will see that the balloon inflates. And the nurse, which will be you, will be holding that syringe down until the doctor says balloon down. And when he says balloon down, you let the syringe empty out and the balloon will go down. When he says balloon up, you'll push it up again slowly, not too fast, because you don't want it to burst. And then it'll be up and it'll go back down again when the doctor says. Okay? So you will continue to advance this. Not you. The doctor will continue to advance it till he gets in the proper place, until you can see that the patient's heart rate is pacing. And then once he gets it into the place he wants, the balloon will be up at that point. And when he gets it in the desired place, he'll say balloon down. And then you'll let the balloon down and you'll lock the syringe so the balloon will not go back up again. You do not leave the balloon down when you're done placing it, because if you do, because it's a balloon, in the force of the blood will jump all over in the heart. You want it to stay stationary in the bottom of the right ventricle. If you leave that balloon up, it's going to move with the flow of blood. So always leave the balloon down when you're in the correct place. So I want you to look over at this. Okay. I want to refer you to our educational board here. This is going to be a resource for all of you when you're not looking at it to come and look at this. It will looks like the one I showed you and where it's located. You can also see the orange kit that you're going to use for the pacemaker. And then after you get the pacemaker in, you will have to do an x-ray. So the x-ray over here, if you refer here, this is what the x-ray should look like if it's properly placed. That you see the catheter coming in and going down through the right atrium, the left ventricle, and the end of the pacing catheter lays in the bottom of the right ventricle. That would be a proper placement. If you look up here, you can also look at it and you can see the superior vena cava. The pacemaker will go through the right atrium, through the tricuspid valve, and lay in the bottom of the right ventricle. It would be improperly placed if it went up and stayed especially near the pulmonic valve or anywhere out here in the middle, because every time the heart beats, this flow of blood moves and you will not have a consistent pacemaker. It will call what we call that it flexes back and forth, and it will not consistently pace. So it's best if it's laying down here. So the x-ray will show that to you. So then also would refer over here to what the pacemaker will look like on the monitor. This transvenous temporary pacemaker that we were just showing you only paces in the right ventricle. It does not pace in the atrium at all, just the right ventricle. And so as you look here, there should be a spike and then a wide complex followed by a QRS, a spike, a wide complex followed by a QRS. That would be proper pacemaking for this type of pacemaker. So it has to be wide, it has to have a spike, and it has to have a QRS following it. And you also need to check your pulse to make sure that the pulse is the same on your patient as it is on your EKG. One thing you need to remember as the nurse that help place this pacemaker is you need to make a strip and put it in the chart of showing that the pacemaker is firing and is captured according to the doctor's order. And then you will write on your strip how many centimeters it is inside of the patient's body, referring back to the pacemaker. As it goes into the patient, you are going to write, say, this is how far before it's placed perfectly. And you'll see that there are 4 lines here. So that means it's 40 centimeters. If it's between 4 and 3, then it's 35 centimeters. And so you need to write on here that 35, 40, whatever the number is, how many centimeters it was when you had this pacemaking. Also, you need to put it on your flow sheet and hopefully on your patient board in the room. Because if sometime it were to not be functioning correctly, you would be able to refer back to this, because sometimes with movement, this pacemaker comes in and out. And so you need to refer back to the number to where it properly paced. That'll be a nursing responsibility. Also, after the doctor has finished, well, actually before he puts this pacemaker in this hole, because we were talking about sterility earlier, the doctor will put the pacemaker through a covered sterile sheath. And it would lead it through here, and then he would put it into the Cortez. And as he gets it to the place that he wants it, this sheath will come over the top and it will cover the end here of the Cortez, thus keeping this whole thing sterile. So then he would pull this out and cover the whole sheath sterilely. He could still move it inside of the sheath if he needs to, but the problem is this thing does move. That's why you need to keep an eye on how many centimeters it's supposed to be, because there's not a true locking system on this sheath here. It locks onto here, but it still has the possibility of moving. That's why documentation is so important for the placement of a pacemaker. So now the pacemaker is in and the patient is pacing. So you're going to find the hook on the back of the generator and hook it up on these IV poles, because these will hold it in a stationary place. And that way it's safety. If you're going to transfer the patient or move them, just take it and lay it in the bed next to them as you're going to transfer them, because we don't want it pulled and pulled out of place. So if you can hook it up safely up there near the head of the patient, that's the best place to do it. Also on here is the plastic cover. That way the pacemaker doesn't get changed or moved by accident. It stays protected. So let's go to the monitor. And how are we going to turn this on so this monitor will know that the patient is pacing? You're going to go to the patient's name at the top of the thing and beep it on the patient demographics. And over here to the far right, there's a little heart. So you're going to push the heart. It says pace mode, on or off. You put the pacemaker on or off. So now that it's on, you want it to be on so that the monitor will read the pacemaker as being in normal rhythm for this patient. You can also do it at the main nurse's station if you don't do it in the room. If you receive a patient who has a transvenous pacemaker already, it's already been placed, what is your responsibility? You need to make sure that the balloon is always down, so your syringe should have air in it. It should be in the locked position. You need to make sure that it's held up nice and tight, that the pacemaker is on. If the pacemaker battery is running low, there's a light here that says low battery. So you need to make sure your battery is always working on your patient, because their life could be dependent upon it. And the other thing is you need to look at the measurement that I told you about to make sure the measurement still coincides with the measurement that's on your board on your nurse's notes. And then the last but not least, for safety, you need to make sure these connectors are in the right place, that they're held nice and snug so they don't disconnect when the patient's moving. One of the other things you can do for troubleshooting, you need to make sure that the patient's heart rate is at least the same as the rate of the pacemaker. It could be higher on its own beats, but it has to be no lower than what the pacemaker is set. So if the pacemaker is set at 70 and your patient's pulse is 60, then the pacemaker is not working correctly. You can't go by the number that's necessarily on the monitor. You need to go by the patient's pulse to make sure the pulse is greater than the number that's set on the pacemaker. If the pacemaker is not working, you may have a beat that has a spike but doesn't have a capture. That means there's not a QRS after the spike and there's a pause in the pulse. That means there's a problem with your pacemaker. If there's a spike and not a pause, and there's spike, 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 and no QRS following it, that drops your patient's pulse and puts your patient in danger. So you need to make sure that it's doing that. And also, one of the other things is there's a problem if you're spiking on top of the patient's own beat. That means you're not sensing the patient's own pulse, and it's trying to pace over and above the patient's pulse. And so that would be spikes on top of the QRSs or in places that it shouldn't be. And that would be a loss of sensitivity. And that would be another thing you would need to let the doctor know. If you see that happening, though, you can come and look and make sure. Sometimes it happens because these are loose or partial has been pulled out. And that's why those problems are happening. Or your battery is low. All those things you can fix. You can fix the battery and you can fix your connections. But if this has come out partially or some other problem that you can't identify, you need to let the doctor know right away, because you are responsible for the proper working of this pacemaker for your patient's safety. That's all. Hope you all enjoy your temporary pacemakers.